the first step in changing how we treat diseases of the skeleton is to change how people think, to make people realize that different parts of the skeleton are really different organs in a lot of respects, and they need to be thought about differently. The goal of our lab is to identify the cell types that make up bone and to understand their role in diseases of the skeleton and also a broader set of diseases affecting the whole body. We wanted to tackle the question of what cells form the bone because this was an area that really hadn't changed very much in the last 100 years. We discovered that the inside and the outside of bone are formed by different stem cells with fundamentally different properties. This opened the door for us to next ask, what if different bones are formed by different stem cells? And opened the idea that maybe the difference in those stem cells now accounts for the characteristic diseases of those different regions of the skeleton. We found that these different cells each make different factors. We've identified these factors, and this now gives us candidates to start working on in developing site-specific therapies for both the direct disorders of the skeleton, but also a broader set of diseases that the skeleton impacts. These discoveries are really the product of not just my work, but even more so the work of a talented, extremely passionate group of young scientists that have really devoted themselves to realizing this project. We're really strongly positioned to turn all of these things into therapies for patients. There's nothing more exciting than when you sit down with a postdoc or a graduate student and have that first look at really groundbreaking data that definitively nails down identifying a new cell type. The Trailblazer Prize means so much to us because it's really that stamp that these ideas have gathered enough steam that they've taken on a life of their own. It is really a license for us to keep going, to keep reaching for what we think are the next stem cells left to discover and keep trying to tie those cells into new human diseases.